What are the risks of getting a vasectomy? And while highly effective and mostly without problems, nothing has zero risk when it comes to a procedure performed on the body. So let's go through it. Number one, you get the vasectomy and you never shoot blanks. In other words, it just didn't work from the get-go. That is usually a technical failure on the surgeon's aspect. So if that happens, got to have the vasectomy done over. It's rare, not zero, probably less than 1% of all vasectomies, as is potential side effect number two, where you were shooting blanks, but a year or 2 or 3 or 4 later, somebody gets pregnant. Why? There's something called recanalization. The tubes actually grow back together. We don't know how that happens. We know that it does, and it is quite rare. Less than 1% of all vasectomies. There's also something called a hematoma. What is that? That means that you bled into your scrotum after vasectomy, and it's the size of a grapefruit with a blood clot. Usually resolves on its own, sometimes has to be surgically taken care of. Again, quite rare. Number 4, the rarest, which is the worst, is called post-vasectomy pain syndrome. Basically, what that means is that 6 months and later following vasectomy, your pain has persisted and does not go away. There's various ways to treat this. Now, I always get a lot of slack in the comments after these videos because I hear all the bad things that can happen. I can only tell you my experience. And in my experience, and I'm not trying to brag, it's just the way that it is, maybe because I've done it for so long and have done so many, I rarely see any of these side effects. Do I see failures a couple of times a year? Yes, I do. Do I see recanalizations from somebody that's had a vasectomy years ago? Yes, I do. Do I see post-vasectomy pain syndrome? Rarely, and hematomas rarely. Now, that's my experience, and I'm sure there are people out there that have not so great experiences. But overall, I think it's a great form of birth control. Make sure you go to somebody that is highly experienced and has done many. Now, if you want to know more about vasectomies, click the link in my bio. I will send you my free vasectomy decision guide.